is a great pleasure and delight to have you join us on this week's edition of the program, Healthcare. You know, our main focus on this program is to ensure that you remain healthy. Because once you are healthy, we know that we have viewers out there watching us, and that is why we always bring you health issues, health tips that will help improve your health condition. And so on the program this week, we have decided to visit a medical doctor to find out more on how you are supposed to keep healthy without necessarily going to the hospital for drugs or whatsoever. So I want to call on you to join me even as I meet Dr. Laetitia Adaudu. She is the medical director, Sharon Healthy Living Center here in Jos. So you are welcome, ma'am.
Thank you, ma'am.
Yes, like I did mention, we will be looking at healthy living. And so I have introduced my guest. She will do more of the talking because she is a professional in that aspect. So we'll just exactly want to find out what is Sharon Healthy Living Center and to what purpose was it established.
Okay, the Sharon Healthy Living Center is the public health clinic, and it's for the purpose of teaching people how to stay healthy, live healthy, and we're also interested in reversing disease, especially those who have been diagnosed and they've been placed on medication, long-term medication. Okay, so it's for that purpose.
So, as a medical doctor, why are you more passionate about healthy living than drug use and medication?
Well, I'm a medical doctor, but I'm also a public health physician, and our focus is to keep people healthy. Yeah, because the prevention is cheaper than treatment and cure. Because when people are ill, they're going to spend so much money, and it's not everyone who gets cured. So it's easier and cheaper and better to prevent and to live healthy. So that's where, and in my practice, medical practice, clinical practice, I saw that it's actually easier to keep people healthy than to treat and reverse disease. So that's where the passion.
Okay. Okay. So have you been in public service before? Maybe worked under somebody, and what is now the passion for this?
Oh, after a medical training in medical school, I worked in a military hospital. I did my house job in the military hospital in Lagos, and worked in public private clinics. I worked with the United Nations, and I used to work with the European Union Prime, which is the immunization outfit for the European Union. So I've been in the clinical as well as in the public health aspect, and actually public health is the bedrock of medicine. So this is where the focus should be, keeping people healthy.
So in your years of medical practice, what are the health trends you are most concerned about?
Well, down the line, over the years, there's an epidemic.
Okay.
Yeah, and I think most people would have noticed the same thing. There's an epidemic of chronic, communicable, non-communicable preventive diseases such as diabetes, obesity, even in children. You see young children with obesity that are overweight, and people think that maybe just well-fed kids. You see younger and younger children wearing glasses. There's an epidemic of that. And this is like a fallout from the trend in the feeding habit as well. People have exchanged real food with designer food, yes, yeah, fake food, you know, and then you think, okay, it's a status symbol to maybe eat meat pie for lunch all the time rather than cooked food and healthy meals. So those are the dangerous trends, which is resulting in all these chronic illnesses, and nobody is making the connection.
Okay. So what do you think is responsible for this lifestyle of eating? Is it the hustling that people are all over trying to make ends meet and never meet, or is it the societal level of people, or what do you think?
Well, I think it's a mixture of factors. Hustling, like you said, people don't have the time to cook anymore, and also the status symbol kind of thing. People think it's, you know, and then a major factor is ignorance. Most people don't know. I remember when I was working in a private clinic in Lagos, there was a mother who brought her child who was obviously malnourished, and she was begging me to treat the child for malaria. And I said, no, this child is malnourished. And you know, okay, what does this child feed on? And she said she outlined it, and it was obviously not balanced. So I said, okay, I'm not going to treat this child. Go and feed this child on this and come back. And then after 2 weeks, she came back, and the child was transformed. Without medicine, just the lifestyle change. Yeah, so people don't really know, and that's where we're coming from, for people to be taught. Because even educated people don't really know what they need to eat to stay healthy. Most times we're learning about different things in our professions, but we don't think we need to learn how to stay healthy. So that's it.
Okay. So Rose Sharon focuses on educating people on healthy living. Could you please tell us what are those lifestyles that are most unhealthy and injurious to our viewer out there?
Well, in this place, we coined it as the cancer lifestyle. Cancer, what is an abbreviation? Cancer is a lifestyle. It's not cancer as you but C-A-N-C-E-R. So C will stand for contaminated. A will be air. So that's contaminated air. Then N is nutrition. Then C is carelessness. So that's another one, nutritional carelessness. Then the ER, E is environment, R is rot, no environmental rot. So you look at the contaminated air, our environment is polluted. You go to the market. I remember there was a time whenever I go to the market, I'll come back with migraine, severe headache, and I would wonder. Then I made the connection that it was because the air was so polluted. Everybody had a power generating set. So the air is charged with smoke and all that. Then you have the nutritional carelessness, which we just talked about. People eat carelessly, and the environmental rot. And another trend that is disturbing is that people are just cutting up the trees just for firewood, and the air cannot be purified. There is so much pollution, but the air is not being purified. That's the purpose of having trees around. So these are the things. So I call it the cancer lifestyle. So we now develop a program around it, which we call the cancer-free lifestyle. Because all of these things I talked about, the contaminated and all that, they are the ones that actually predispose a person to cancer, which is also preventable.
Okay.
Yeah.
So now, what exactly do you do in this place? Do you do counseling? Do you run seminars? Do you do workshops? Or do people come here to seek for advice?
Well, first and foremost is a public health clinic. So people come like a regular clinic, and they are attended to those who have illnesses. Yeah, so we treat them with lifestyle change, and what we developed and called pharmacotherapy. Instead of chemotherapy, radiotherapy, we call ours pharmacotherapy. Food as real medicine. Pharmacotherapy rather than chemotherapy, radiotherapy, and all that. So that is what we sell to these patients, as the means of treatment. Yeah. And then we give seminars to corporate bodies, to private organizations on healthy living.
So who are these services targeted at? Is it the children? Is it the men? Is it the women? Or it cuts across board?
Everybody. Okay. Both the healthy, both those who want to stay healthy, know how to stay healthy, and those who are already ill and want to reverse disease. And so our services are directed to everybody, both men, women, children, healthy, non-healthy. Because we teach you how to stay healthy, and we also reverse disease, help them to reverse disease. For example, I have a patient right now who's been diabetic for 30 years and been on drugs for 30 years. Not that there's a place for medication, yes, but not that you have to live with medication all your life. No, that is wrong, because you are damaging your vital organs, the kidneys, the liver. Eventually that kind of patient will come down with renal failure, kidney failure. Yeah, so we don't encourage that a patient to be on drug forever. Yeah, so that patient now his blood sugar is now being controlled just on lifestyle change and on pharmacotherapy. So that's the kind of thing we do here. There was a young girl that was brought here all the way from Taraba, and she's in her early 20s, but she's been on drugs for 19 years. for migraine, severe migraine, you know, and just a few weeks, of the pharmacotherapy and change in lifestyle, she has only had to use her medication just twice. Yeah, so that's the kind of thing. We reverse disease here. And we teach people, keep people healthy. So those are the two things that we focus on.
Okay, our mentality. We only wait until we are sick before we visit the physician or before we seek medical advice. So in these years of practice, you have been there with the sick, now you are advocating, come even if you are healthy so that your living, your lifestyle will be better. So what do you have to say to our viewer in terms of only waiting until we are diagnosed, until you are down, you can no longer wait? Some of us prefer that, okay, let me just come. Why should I go for investigation? So what do you think is the best thing to be done?
Well, we started by saying that prevention is cheaper than cure.
Yes.
Yeah, because I've had patients who, with so much money, could not be helped because it was already too late. You see people dying with millions of naira in their hands because it was already too late. So it's better, right? Not that it is a negative mindset to try to know what is wrong or to stay healthy. Here we actually focus on the, we tell you that you're the doctor of yourself, not waiting. Because what you find that most patients don't even know, even educated people, you ask them, what drug are you on? They will tell you, I don't know, the doctor just gave me. But here we don't do that. You are a doctor of yourself. You have to know how to take care of yourself. That's the duty of the doctor, is to teach the patient how to take care of himself. So people need to know that it is cheaper that they learn to stay healthy than to wait until they are ill. Yeah, before they, for example, even just ordinary malaria. Now you see people that are always running to the hospital and getting treated, and they don't know what it is doing to their system. All that medication, chronic medication, would eventually affect the vital organs, and eventually the person comes out with kidney failure in his mid-life and will not be able to trace it back to that lifestyle, that unhealthy lifestyle. So we advocate strongly that people stay healthy. And of course it doesn't make sense, you know, you see a hospital as only a place where you go to get well. But here we say you stay well, we teach you, we keep you staying well. Yeah, because you are more productive to yourself, to your family, and to your society that way.
Yes, staying well, that's the main focus. We have been looking at healthy living. So, in terms of this healthy living, does what we eat, what we drink, maybe the kind of job that we do, our social life, does it have any effect on our health? Are there tendencies that it can make us unhealthy?
Well, yes, because the person, the human person, lives in an environment. And when we say environment, it's not just the physical environment, but your work is an environment, your family is your emotional environment. So all of this affects you as a person. It affects you psychologically, physically, in totality. So all of those things. If you find somebody who is so stressed out, for example, you know, having one illness or the other, and he might be on medication for, you know, for that stress. He maybe cannot sleep, for example. You know? But if you address a particular factor in his environment, that could help him reduce the stress and cure him of the stress. Yeah, so here we look at the person in totality as a person. We don't look at symptoms. We don't treat symptoms. For example, we don't treat headache. We don't treat what else? You know, we treat you as a person, because the symptoms are just signals that something is wrong in this body, and this body belongs in an environment. Do you understand? You are coming from a home. For example, malaria. Okay, a patient comes, you treat the malaria, he goes back, comes back again. But how about the environment? What if he cleans his environment and then mosquitoes don't breed again? Yeah? So that is, that person is cured of. He doesn't have to. Malaria is something preventable. Diabetes is preventable. Hypertension is preventable. Obesity is preventable. Arthritis is preventable.
How is diabetes preventable?
Yeah, from what you eat. It's mostly, apart from those who are born with the insulin dependent ones, but the adult onset diabetes is very highly preventable. Just what you eat. Watch what you eat. Yeah, because most of what we eat right now is actually setting us up for all these diseases in our midlife. Yeah, you even find people in their 20s already with adult onset diabetes because of what they eat. So that is what we put in is very important for how we live, because the body has an immune system, yeah, which is supposed to fight most of these things, and the food we eat is the fuel, is the fuel that the immune system needs to do its work. So when it's not getting the proper fuel, it will eventually break down, so it cannot fight diseases anymore. So you are just subject. Even cancer is highly prevented. Yes, but yeah, the same thing. Your immune system, the same thing. Yeah, there are things that trigger our cells to become cancerous, and those that actually suppress that process from taking place. And it's all based on how you live. Yeah, but this is not a forum for that. It will make it too technical. This is just an introduction.
Okay. The economy, of course, is so challenging. So maybe as a result of it, somebody has developed high pressure because he cannot meet such needs. Somebody is left with migraine headache almost on daily basis. So what piece of advice do you have for such people to remain healthy even with the economic difficulties?
Well, the first thing is that worrying is not going to solve anything. That's number one. And it's actually a contributing factor, and he's going to spend much more money trying to treat himself. Okay. Yeah, so it's worrying won't get. Anxiety is actually a factor that contributes to disease. So stress is a big factor that triggers the patient to other illnesses. So it's better avoided. Because once the process is setting, it's difficult. You see people who are anxious, they come down, they develop high blood pressure and many other things, and afterwards it's difficult to control. So it's better to prevent than to start looking for a solution.
Initially you made mention of a case from Taraba. So are there some other cases that have been reversed, or do you have special drugs for it, or is it the normal drugs that are available there?
Oh, what my focus here is actually to reverse disease, because I think we have enough clinics putting patients on medication, and the average person, even doctors, no doctor wants to be on medication. I have lived with migraine for more than 13 years, and until I changed my lifestyle, I was always down with migraine headache, so I know what it is. So what was the question again?
Okay, I said
okay, other cases.
Yes,
cases. A number of cases. There was a patient that was sent from Abuja here. He had stroke, hypertension, and diabetes. He was on 2 medications. His doctor had put him on 2 medications. And when he started the pharmacotherapy, just 3 weeks into the pharmacotherapy, his blood sugar began to normalize, and his doctor took him off the medication. Yeah, so there's a place for medication, but patients don't have to be sentenced to medication because they have their side effects, and doctors know that. So no doctor would encourage the patient to be on a lifetime medication, which is what most patients are on. And the medications they don't treat, they just manage the condition. So the lifestyle and the pharmacotherapy is what will actually help the body to treat, to cure, to regulate the functions of the body.
So now in Rose Sharon Healthy Living Center, what makes you different from other clinics and maybe other centers?
Well, here I think we are like the first kind of lifestyle clinic. Maybe I will make good decision in Nigeria. Not combining medication, and it's purely, you come here, we teach you about lifestyle and how it affects your health. Yeah, so that is our focus. We are not mixing and matching. We are helping patients get off their medication, that they can live again without drugs. That's how we are different, and we look at the patient as a person in an environment, not as a symptom of headache, fever, and all that. And we look at you as someone, a human being with these symptoms, being caused by things in your environment. Okay. So I don't know, because I have worked in a regular clinic, and I know that in the regular clinic you don't have that much time to go into a person's background, family setup, environment, and how it affects his health condition. So that is what public health is all about, and that is what Sharon Health Living Center is all about, looking at disease from the person's point of view, not just as a symptom.
Okay. So that is to say, you don't work on somebody else's symptoms. Maybe I have come with migraine headache, or I have come with diabetes, and you just generalize. Another person is coming with another ailment, and you generalize. So you looked at the person as an individual.
Exactly, because like, okay, that young lady that came from Taraba with migraine, and it was so interesting when I was talking with her, because when she told me where she lives, what all the triggers and all that, it was like an ABC situation. It was very easy. And once she adopted the lifestyle we proposed to her, it worked for her. Okay. You know, so somebody else coming with, I'll have different diabetic cases. You know, they are different. They come from different environments, you know, and those environments affect their situations, or what they affect their health condition. So you will not generalize. You know, and I don't tell patients not to use their medication. No, once they are controlled, doctors take them off the medication. For example, the patient that came from Abuja, it was his doctor that took him off his medication. Why? We don't deal with that. No, we just teach you how to stay healthy. And then once you begin to normalize, your doctor will do the remaining. Take you off or reduce your dosage.
Okay.
Yeah.
So in a nutshell, cases that maybe people call terminal, immediately you hear such cases, you give hope for such cases.
Well, I've had a number of terminally ill diseases. Yes. Some of them have died, but they did not die in hopelessness or in such severe pain and all of that, and most of them came in the very last moment. Yeah, I have a patient now. She was being treated for cancer, and she even had her kidney removed and all that, and she came back after the first round of chemotherapy. After some months, she came back with a result that showed that the only kidney was failing. Yeah? So we put on our chemotherapy, and gradually after some weeks, the results started normalizing again. The kidney function test that she did, yes, which showed before that it was failing. And so that is the kind of, even if we cannot totally treat, we can bring you to a point where you can live at least a comfortable life.
So don't you foresee a resistance maybe with other medical professions maybe out there?
No, I don't. Okay. I think doctors actually want their patients to get well. Is because of the kind of training we had in medical school, that we were just, the focus was mainly on medication, but every doctor wants their patient to get well. So if there's a better way, a simpler way, a natural way, do you understand? They will adopt it. Even as a medical, working in the clinic, I was already teaching this to my patients. So there's no conflict. It's just that I choose not to go into drugs. Yeah, but they can adopt and tell their patients about healthy living. And they already do, it's just that the focus is on medication. Yeah, most doctors will tell you, do this, don't do that, but the focus is still on drugs. But here our focus is on lifestyle. Yeah.
So, looking at it, the financial aspect,
yeah,
don't you think that in this place maybe there's that tendency you're running at a loss rather than working for somebody? You get fat your account, you get fat allowance at the end of the month, and maybe here it's more maybe of charity and it's not forthcoming as you get there.
Well, it's not exactly, in fact it's not charity.
Okay.
It's not charity because you still pay your consultancy fee, yes, and yeah, you still get to pay your consultancy. It's like a private clinic, but it's a private public health clinic. We are not on salaries. People's patients and clients pay, but those who see the need will pay. Yeah, because it's affordable. Anybody can afford it, and it's cheaper than going to India to have to get a kidney, which is what is happening. And I like to tell people, this is the time to learn and to stay healthy. Because when you have to go to India, you might be, I know people who have gone to India, got the kidney, came back here and died. So that is not the solution. The solution lies within you. Yes, it's within you.
Something, don't worry. So, okay, don't you think, do you think that it is Nigerian doctors that are not able to meet up to the health needs of the people? That is why everybody is crazy about going outside the country. Or what do you think would be responsible?
A mixture of factors. We have health facilities that are not of standards, they are not well equipped, so it's not really the doctors' fault. We have the best doctors in Nigeria. We have the best doctors. I make bold to say that. We have excellent doctors, but we don't have the facilities.
Okay.
Yes. So that's why people go to India, because it's cheaper and we have the facilities.
Okay. So in trying to round up, what do you have for our viewer out there?
Well, I would like to say to you viewers that you tune to this program because it's your responsibility to know about your health, to stay healthy, and your health is your responsibility, not the doctor's. Okay. So that's what I have to say.
Yes, to you out there, I'm sure we have been able to give you what will make you stay healthy. We've not come up with any drug formula, we've not come up, but we have come up with a formula looking at your environment, knowing what you eat, knowing what you do so that it can help you to remain healthy. And so we have been together with Dr. Laetitia Adaudu. She is the medical director, Sharon Healthy Living Center here in Jos. We're truly very grateful.
My pleasure.
Yes. So she has given you from her wealth of experience, a medical doctor by training. She has practiced and now she has come back to say public health is very, very important. She has given us some acronyms that if you come around, maybe you get to know more about it. But if you wish to get across to her, you can always contact us on this program so that we can link you up, because once you are healthy, I've always emphasized, it gives us great pleasure because you are there watching us. So you can come across us and we link you to her. On that note, I sincerely appreciate everybody that has made this program a success. Until I come your way next week again with another wonderful package, God's willing, I remain sincerely yours, Rebecca John. Thank you.